This video is the property of Hill Oral Surgery. Any distribution is prohibited. Hi, I'm Dr. Marcus Hill. Thank you for taking the time to watch this consent video on dental implants. And thank you for trusting me with your care. A dental implant is a screw that goes in your jawbone and supports a crown or bridge. It's a fancy, expensive titanium screw, but fundamentally, it's a screw just like any other. A dental implant consists of the main screw in the bone, which is the stage 1, and a second part which goes from the bone level through the gums that's called an abutment or stage 2. This serves like the stub of a tooth for your dentist to glue a crown or cap on top of. Now, in order to place a dental implant, we must first prepare the site by drilling holes in the bone just like you would in hardwood. These are successively larger until it gets to the size of the dental implant. The dental implant then goes in nice and tight. After placement, the implant will have to be left untouched for 4 months. During this time, the implant fuses or osseointegrates to the bone, making it strong enough to support chewing on it. Then the second stage can be completed and your dentist can make a crown. If there's not enough bone, we may have to bone graft at the time of implant or potentially perform a bone graft prior and then wait 3 months for the bone to heal. Then we'll come back and do a second surgery to place the implant. If a tooth is extracted, that is intended to be used as a future implant site, we will often do a bone graft at that time to maintain the width and height of bone to make it ready for a dental implant. This bone comes from a cadaver, but is sterilized and irradiated, making it safe to use. Sometimes a dental implant can be placed the same day as an extraction. Not all teeth are a good candidate for an immediate implant. However, this is my specialty. During my 8 years in the Navy, all the dental work was free, so every tooth I took out was an attempted immediate implant. I will only place the implant, however, if I can place it in the ideal position. If waiting for the bone graft to heal and then come back will allow a better position and long-term result, then that's what we'll do. There's no additional cost to this, it just takes longer to complete the treatment. Many teeth can be saved with dental fillings, crowns, root canals, and whenever possible, this is usually the best option. However, if they cannot, I'm happy to help. If your dentist recommended a dental implant, then I can either place it with you awake using numbing medication or with you sedated in the office. Now, lidocaine is a numbing medication often referred to as Novocaine. With numbing medicine, you'll always feel pressure and vibration, the same way as normal. That said, you shouldn't feel anything sharp or painful. If I push my finger against your gums, you'll always feel that pressure. But if I used a knife, it would feel the same as my finger, just pressure, nothing sharp or painful. Dental implants can also be performed under sedation. For sedation, when you come in, we will start an IV in your arm, give you medications through it that make you relaxed and sleepy to where you don't care what's going on. And when you look back, you are unlikely to remember anything that happened. You'll be deeply sedated, but it's still very safe because you're still breathing on your own, your blood pressure is maintained. You're just checked out to where you don't care what's going on. You're not intubated. The lights are on, but nobody's home. While sedated, you will get all the same numbing medicine as if you were fully awake. So when you wake up, nothing should hurt. There shouldn't be any pain. And the pain will slowly increase over the next days and as the numbing medication wears off. So I do recommend you take ibuprofen if you're able to when you get home. You'll also be prescribed a mild narcotic to take only if you need it. I recommend you take the narcotic a half tab at a time, and you can always take the other half an hour later if the pain is still intolerable. The pain does get worse over the first few days and will slowly resolve. To minimize the pain and swelling, I recommend you ice your face for the day of surgery and the day following surgery. This helps prevent pain and swelling. The swelling usually peaks 3 days after surgery. Placing dental implants can potentially damage the structures near the implant site. There's a nerve that runs through your lower jaw that gives you feeling in your lip and chin. The risk of permanent nerve damage is very low, but 10% of the time there can be bruising to this nerve in certain teeth. There's also a nerve that goes to your tongue, but this is even less likely to be damaged and is usually temporary. The upper teeth are near the sinus cavity. There's often only an eggshell-thin bone between the tooth and the sinus cavity in the back teeth. When placing an implant near the sinus, we will often try and use the entire height of bone, and the implant may slightly go into the sinus cavity, or we may add bone above it. This can make a hole between the implant site and your sinus cavity. If you blow your nose afterwards, you can blow bacteria from the sinus into the healing socket, And this can cause swelling in your cheek, it can cause an infection, and it can cause your implant to fail. So try not to blow your nose. The problems usually resolve on their own, but may require an additional procedure. Although a serious sinus complication is low, if you do have sinusitis or congestion, take over-the-counter sinus medications for the first 2 weeks after the surgery. You can also use a saline spray to inhale gently. Just try to avoid blowing your nose out. The most common complications are bleeding and infection. If you don't have any bleeding problems and you aren't on blood thinners, this risk is very low. But follow the post-operative instructions, bite down on the gauze to get the bleeding to stop. Infection, however, is a legitimate risk. To minimize this risk and to help your implant be successful, I will write for a prescription mouth rinse and an antibiotic for you to start the day before the surgery and continue for the week after. At least 93% of implants are successful. However, they do sometimes fail. When they do, the problem usually presents like a tooth infection and is mild. To minimize the risk of failure, try to follow the written post-op instructions. If an implant fails, we'll have to wait at least 3 months before we replace it, and then start on the same timeline towards completion. I place sutures in most sites to help you heal faster. They are usually unnecessary and will not be replaced no matter when they fall out. The sutures dissolve on their own, and there is nothing you need to do with them. Don't pay them any attention. If bone graft was done, small pieces are likely to fall out and make their way into your mouth. This is normal. Do not worry about it. But try and avoid traumatizing the area to try and keep the most bone in as possible. Please read through the detailed consent form you were given. The paper consent, rather than this video, is the actual consent. You may also visit my website, hilloralsurgery.com, for more information about me and to watch this video again. If you want sedation on the day of surgery, there are 2 important things you need to do. First, have nothing to eat or drink for 8 hours prior to the surgery. This includes water, nothing to eat or drink. The second is you need to have a driver come with you, stay with you the entire time, and take you home afterwards. Now, I look forward to meeting you on the day of surgery. Don't be nervous. This is much easier and safer than you imagine it to be. Thank you for your time and trust. I look forward to meeting you.